Hello, everybody. Good morning. Happy Sunday. It's February 19th and it is President's Day weekend. So, hopefully, if you do live in the US, you have it off tomorrow. Without much further ado, I am Dr. Val, and today I will be doing a live Q&A. And so on my social, we had some questions already inputted, so I will be going over those. And if you are here live, just go and type in the chat anything you want to ask me. Okay, so let's get started. The first question is, how do you cope with menopausal insomnia? Really, really good question and very common to have difficulty with your sleep in and around menopause. So, menopause, the average age in the US is 51. I think a little bit similar across the globe as well. The average age of perimenopause is 47. And what's the difference between perimenopause and menopause? So, perimenopause is when you start to have fluctuations in the hormone levels, which can lead to different symptoms. Sleep difficulties is definitely one of them, hot flashes, night sweats, mood instability, decreased libido, and so on and so on. Menopause is actually after not having your period for 1 year. That's when you're defined to be in menopause. And so, as women get older, as we start to have changes in our hormone levels, it definitely can affect our sleep. And as a medical sleep doctor, and then just as a disclaimer, even though I am a medical sleep doctor, here on my YouTube channel, we are just providing health education. So if something does come up from something that I say, please talk to your doctor definitely about it. And if you're looking for a menopause specialist, if you check out the North American Menopause Society, the NAM Society, they're actually licensed practitioners probably in your area where you can find someone who really knows menopause. Okay, so back to the question. How do you cope with menopausal anxiety? And, as a sleep medicine doctor, the question always is, okay, so what is causing the insomnia? Do you have a hard time falling asleep? Do you have a hard time staying asleep? So, differentiating between those two, I would say commonly what I see in women who do have perimenopause and menopause, A, it's the hot flashes, B, probably untreated, undiagnosed obstructive sleep apnea, C, stress. Stress can definitely play a role, anxiety. And so, addressing those sort of three main issues is how I help someone cope with their insomnia. So, if you have a hard time falling asleep, another concern that it could be, and this is not unique to perimenopause, is sometimes people go to bed because of what the clock says. What do I mean by that? So it's 9 o'clock. If you have kids, maybe young kids are already in bed, or maybe your partner's already in bed asleep. Then you're thinking, man, I should be asleep too. I got to wake up at 5. I got to do a couple things and commute to work and blah, blah, blah. However, if you're not tired, don't go to bed yet, right? We have these internal clocks built within us, and they're called our circadian rhythm. And so, some people, about 20% of the population, your clock is just a little bit delayed, where you really don't feel sleepy until around midnight or even later. So, if that's the case, there are certain things that you can switch your clock back, but just really knowing the sleepiness cues of your body can be helpful, right? Starting to yawn, starting to feel like your brain is slowing down, your eyes still heavy. Those are the cues when you should go to bed. Yeah, good, good, good. The next question is sleep disturbances, oh, I'm sorry, are sleep, let me read this again. How do sleep disturbances contribute to weight gain in menopause? Oof, really, really good question. So maybe like take out the word menopause, right? How does sleep affect weight gain? And we know this from people who work night shift. Typically, they sleep less overall. When you're up longer, you can eat more. You just have more opportunities to eat. But also, it affects your hormones and metabolism. So when you don't get enough sleep, it's actually an inflammatory state. So it can affect things like your insulin level. You can become more insulin resistant. Also, your hormones that make you want to eat more. I think this hormone specifically is called ghrelin. I think of it like a gremlin wants you want to eat more. That one goes up. Leptin makes you feel full. That one goes down. And you can gain weight. In addition, right, when you go through perimenopause and menopause, right, you don't have as much growth hormone. getting older as well, and so that can affect it. So yeah, it's almost like a dual effect. Like if you're not, if you go through perimenopause, menopause, and you're not sleeping well, that can affect your sleep. But in and of itself, people who do have perimenopause, menopause can gain weight. Interestingly enough, being on hormone replacement therapy, if you're a candidate, can actually help with the weight, stabilize the weight, and also with the sleep. So if you are a candidate and if you're interested in it, talk to your doctor about it because there are treatments for perimenopause, menopause. It is not a disease state, it's a natural part of aging, but along comes with it some uncomfortable signs and symptoms. So yeah, please, please, please talk to someone about it. Okay. When I go to bed, I take a very long time to go to sleep. How can I solve this? Ooh, good question. Um, and so we can break this down. What does long time to sleep mean? So average time to take it takes someone to fall asleep, actually up normal can be like 20 to 30 minutes. We call that sleep latency in the world of sleep medicine, sleep science. Um, how can I solve this? Well, it goes back to why do you have a hard time falling asleep? I'd say oftentimes, the world that I work in is a sleep medicine world. And so I help a lot of folks who have insomnia. And really, why? Twofold. Going back to that circadian rhythm issue where they don't feel tired, but they're going to bed because they think they should go to bed. And the other reason is because their brain just doesn't want to shut off, right? It's a wheel that keeps going and going and going, and sometimes this wheel hasn't been able to slow down, and it's been going and going since childhood. And one of my favorite analogies is because I have a toddler, thinking about a toddler who has a tantrum and think of your brain like that, or thinking of a young puppy, right, that's constantly chasing its tail. It's going around and around and around, which I hopefully it gives some people hope in the fact that you can actually tame the untrained brain, right? So I had a dog in college, and I remember bringing it to PetSmart for puppy training classes because it was really, yeah, it was a terrier, so it was not the most calm dog. But right, the teacher said 10 minutes a day. That's all you need to do. Just train it how to sit. Use a little puppy treat, right? Give it some love, and then with time, yeah, the dog actually was really good at doing some cool tricks. It would sit. It would actually play dead. Yeah, it was a pretty cool dog until unfortunately ran away. With that said, think of your brain like that, right? Think of your brain like a muscle. There's a part of your brain that definitely wants to relax, that needs to relax, and we know this. It's the autonomic nervous system, and specifically the parasympathetic. So, a lot of people who have a hard time sleeping because their brain is constantly going or they're constantly worried. It may not even be any specific worry. Sometimes people are just more creative at night, and their brain just keeps going. So, what do? Is we learn how to turn down that stress response, that sympathetic drive, and then turn up the parasympathetic. So, going back to the analogy of training a puppy dog, 10 minutes a day, can you practice a relaxation breathing meditation? Or can you write down your thoughts? So, I really am a big fan of journaling. And, there are a lot of prompts out there, and I can give you some prompts as well. Sometimes it's just write down what you think about sleep. And that's sort of the activity I like to do with a lot of my patients who have insomnia. It's just dialing down, okay, why do you have a hard time sleeping? Where is this coming from? Some people have told me that, sleep is their enemy, or sleep, when they think about sleep, they feel really sad. And it's something that, they know they should be able to do, but they just feel like a failure. A lot of people feel really hopeless and have a lot of fear about their ability to sleep, which it doesn't have to be the case. Working with a lot of my patients, this whole practice is called cognitive restructuring. Sometimes we have a lot of negative sleep thoughts or cognitive thought distortions that can actually keep us from getting great sleep. And so you can choose better thoughts. You can reprogram your brain through cognitive behavioral therapy if that's the reason why you have a hard time falling asleep because your brain keeps going and going and going. Um, oh, I like this question. How do I find out if I have sleep apnea? Easy, get a sleep study. This is what I order probably 10 times a day, almost every day, well, when I'm working. So let's just break down what is sleep apnea. Sleep apnea is a medical sleep condition where the muscles of the upper airway, typically it's the tongue, falls back and closes off your airway. Signs and symptoms for this include snoring, gasping, choking, stopping breathing. For women, you may not have all those symptoms. Sometimes women just report waking up feeling really unrefreshed, having a headache, and having some mood instability. It's very common, 1 in 5 adults have it, especially as we get older. And then as we go through menopause and perimenopause. Why? Because those hormones, estrogen, progesterone, are actually protective to make the airway more strong. And once those start to decrease, right, things get a little floppy, like all over our body. So with that said, how do we diagnose this? There's two ways. There's in-lab test and home sleep apnea test. Typically, most insurances just cover the home test, and they're pretty straightforward to use. The one that I use in my clinic. Basically, if you can put on a belt and you can put on a watch, you can do the study, no problem. There's a nasal cannula in your nose that monitors the air moving in and out. A little computer device that sits on your chest. You clip it to your t-shirt. It's about the size of a pager. Has a microphone in it, and so it can hear if you're snoring. A belt around your waist and chest monitors the lungs moving up and down. There's a wrist device that tells us if you're awake or asleep based on movement. And then the finger probe measures your oxygen and your heart rate. So one night is all we need. The more sleep you get, definitely the better. And what we look for is how many times an hour you have difficulty breathing. 5 events per hour or greater is diagnostic of obstructive sleep apnea. Yeah, so pretty straightforward. And if the home sleep apnea test is negative and you're still really, really tired, I don't recommend to stop there. Go ahead and ask for the in-lab sleep study. Home sleep apnea test may miss 5 to 10% of patients. Women, I would say in particular. Why? Because sometimes our brainwaves wake us up before our airway completely collapses. So the home sleep apnea test may not be as specific enough to pick that up. Yeah. So that's how you find out if you have a sleep apnea. What causes sleep paralysis? That's a good question. And it is something that I do hear often. I don't believe it is more common in women, but really what sleep paralysis is there's 4 stages of sleep. Stage 1, stage 2, stage 3, and then REM. So typically during REM, we have our most vivid dreams. We can actually dream through the other stages of sleep, but REM is our most vivid dreams. When we go into REM, our bodies are paralyzed except for our diaphragm, so that we can not act out our dreams, right? So, I don't know if you've ever dreamt about running or jumping off a cliff. Imagine if you actually did that in bed and you'd fall out of bed and you could hurt yourself. So, our bodies are actually paralyzed, our skeletal muscles are paralyzed, so we don't act out our dream. What happens with sleep paralysis is that your brain is waking up before your body wakes up. It really only lasts a couple seconds, but if you don't know why this is happening, then it can be really, really frightening. So, several reasons why. Number one, sleep deprivation. Not getting enough sleep can lead to this. Untreated sleep apnea, right? Because that can disrupt the quality of sleep you have. Someone who has narcolepsy, and that's a condition where instead of going through the stages of sleep, 1, 2, 3 in REM, you are sort of all jumbled. So, you're awake and asleep at the same time, you're in REM and you're in non REM, and you could just wake up and your body doesn't move. Yeah. So if you do have sleep paralysis, make sure you get an adequate amount of sleep. For adults, that's 7 to 9. If you are still getting that and you have underlying concerns for narcolepsy or sleep apnea, talk to your doctor about it and get the testing you need. What are permanent treatments for sleep apnea? Oh, very, very good. Yeah, a lot of medical sleep questions today. So, permanent treatments for sleep apnea, and it all depends because sleep apnea affects, is a really cause of the anatomy. There's multiple levels of obstruction, either the nose or sinuses, the back of the tongue, how big your neck is. And so, some of the literature really supports surgery as a resolution for sleep apnea. We see this more oftentimes in kids who have really big tonsils. Removing the tonsils can resolve it. Believe it or not, some people have part of their tongue reduced, so the base of their tongue sliced off. Um, yeah, surgery, weight loss, I would say, but it also depends on how big the hole is in the back of your throat. I'm sure you've seen people whose chins are very quite small, and so the type of surgery they would need to have, and they could be normal weight, is actually breaking the jawbone and pulling it forward. That can help. Yeah, surgery, weight loss, and then being on a CPAP machine doesn't necessarily permanently cure sleep apnea. It's a treatment because when you're not on the machine and if you're sleeping, the muscles of the airway narrow and collapse. Yeah. Additionally, not something that not everybody talks about is body position. Sleeping more upright, sleeping in a recliner, getting adjustable bed can be really beneficial for some people who have positional sleep apnea. Sleep apnea that's worse when you're on your back because the tongue falls back and closes off their airway. I had some folks who in the lab had very, very severe sleep apnea because in the lab they have them lie flat because we want to catch the worst possible scenario. But if at home they don't sleep flat on their back, they sleep on their side, they have a special bed that goes up, then you may not have sleep apnea. It may just reduce the severity, but I have seen some folks who've had severe sleep apnea in their bed, sleep in a recliner, do a home sleep apnea test, and now that they don't have the signs and symptoms. So it's really good. Yeah. Good. Next question. What happens if you regularly only get 3 hours of sleep at night? I hope this is not you. If you do, please talk to a sleep expert. A lot of things I would say it's not really good for your brain. It's really inflammatory for your brain. Your brain doesn't have enough chance to clean out the toxins for the day. It may be associated with things like dementia. It's really not good for your heart. Your heart has to work a lot harder and longer if it's awake longer. So increased risk for things like high blood pressure, irregular heartbeat. Your mood can be greatly affected. I mean, there are some people who are short sleepers where you get less than 5 hours. But I would say if you're only getting 3 hours of sleep at night, take a look at what's going on in your life and really prioritize your sleep health because without health, what are we? Next question. What is the ideal amount of sleep time that a midlife woman needs to be healthy? There actually isn't a specific time for genders for men versus women. Um, However, yeah, 7 to 9. 7 to 9 is definitely what is recommended. And then the next question going along with that, do humans need 8 hours of sleep per night or is this a myth? 7 to 9. I think of sleep as sort of like fuel. So if you are having a pretty busy week, a lot of like meetings at work, a lot of projects, and you know that you function better on 8.5, 9 hours of sleep, okay, get that much. Versus on the weekends, you're just gonna chill, maybe do some grocery shopping, and you want to watch a show, and you stay up a little bit later and only get 7 hours, probably okay. But find out how much sleep you need. What's your sleep need? Meaning, after how many hours of sleep do you feel good? And if you're sleeping between 7 to 9 hours and you're feeling tired, then that's a reason to go visit a sleep doctor. Yeah. What is the best way to get a good night's sleep every night? Position, sleep remedies. Yeah, so optimizing your sleep. And I think it comes back to, yeah, what symptoms are you having, right? Are you waking up refreshed? Are you snoring? Pre-sleep remedies, things like supplements. Yeah, these are good questions and probably need a little bit more information. I would say going back to finding out how much sleep you need. So if you find out how much sleep you need, and then you match that with your circadian rhythm, when are you most likely to fall asleep within 10, 15 minutes? Are you more of a night owl? Can you match that to your world environment? Yeah. Why is it bad to eat before going to sleep? Is it even bad at all? So, food and sleep and timing. I think, yeah, I have something on the blog, sleepforward.com, if you want to look up food and sleep. The timing, because our bodies need to digest the food, right? And if we eat and the food, and we lie down, the food just sits in our stomach, it can reflux, right? As we get older, our sphincters aren't as tight. And so we can have issues with acid reflux, and that does not feel good. Um, so that's one thing. And then depending on what you're eating, it could actually affect your sleep architecture. What do I mean by that? Your sleep stages. Yeah, some foods are more sleep promoting because they have the building blocks for melatonin, like tryptophan. However, yeah, it just really depends. I mean, certainly, if you drink caffeine late in the afternoon or evening and have a hard time going to sleep, then, yeah, that can be pretty bad as well. So just take a look. If you have a hard time sleeping, look at what you're eating, the timing of when you're eating, if you're having these symptoms like indigestion, acid reflux, right? And then, yeah, most of the foods that do, small studies, but the foods that are better or more beneficial for prior to bedtime are things um, that are plant-based, right? Things that have high fiber. Fruits and vegetables, I think, in general are good for us if we can digest it as well. Yeah. Oof, this is a question that like pains me a little bit. Is there a way to rewire your body to require less sleep? No, not that I know of. My question is why do you feel you want less sleep? I mean, I think I have certainly felt like that sometimes just because there's other things that I need to do, like projects that I'm working on. But yeah, sleep is amazing. When you get an adequate amount of sleep, your brain actually works better. So you can perform better. So please, please, please prioritize your sleep and don't try to get less. I would say if you don't have any cardiovascular issues, so high blood pressure, regular heartbeats, you can probably get away with like 6.5 hours, greater than 6, but not for a long time, right? Yeah, it's really better for your body, your brain, your immune system to get more sleep. Alrighty, we are going up on 20 minutes now and a couple more questions, but yeah, just seeing how everyone's doing. I think I'm just going to do one more question, and this one is all about napping. Is sleeping, taking a nap at noon bad for health? So my nationality is, well, my ethnicity is Filipino. And in the Philippines, right, sort of Spanish induced culture, right? The Spaniards were there for about 400 years. They have a siesta time. And so countries that have a siesta time, it's just because it's so hot near the equator, you don't want to be outside, you can't do anything. And so you do take a nap. So is that bad for your health? Well, I think if you're so tired because you're not getting an adequate amount of sleep at night, yes, that certainly can be bad for your overall health. And so taking a look at why you're not sleeping enough or if you have an underlying sleep condition. A short nap is fine, 10, 15 minutes. It may be more beneficial than actually drinking caffeine because sometimes the effect of caffeine can last in your bloodstream in your system for too long and it can keep you from sleeping well at night. But yeah, I think, right, in medicine, it just depends. And if you have questions, talk to your doctor about it. So this concludes another video for the sleephoria.health channel. Thank you so much. And if you have further questions, go ahead and put in the chat and then I'll get to it when I get to it. Have a great rest of your day and sleep well. Bye-bye.